Thank you, Mr. Speaker. When the Minister of Health created one provincial health board, one of the reasons he gave was that it would allow innovative ideas and policies from one health region to spread to others. He knows that money put into health promotion and disease prevention reduces costs to the healthcare system. Regrettably, the Minister has not shown much interest in prevention and health promotion since taking office. Why did the Minister reject the innovative policy of banning trans fats in Calgary restaurants when Alberta Health Services took authority? Has he learned nothing from the tobacco reduction strategy?
The Honourable Minister.
Mr. Speaker, nobody banned anything, but what we have done, there was a policy that was put in place by the former Calgary Health Region, but had not been in place elsewhere across the province. As the member correctly points out, that we now have one health board in Alberta. But more important than that, Mr. Speaker, is the fact that we believe strongly that these types of policies should be national in scope, and so I have taken the initiative to write to the federal minister and ask her when there would be federal initiatives coming forward. It's strongly encouraging that, and I'd be happy at the end of question period to table that letter, Mr. Speaker.
Surprised with that?
Thank you, Mr. Speaker. Well, the Minister had an opportunity to lead the country by expanding the policy to the rest of Alberta, yet he did not take it. Why did the Minister not direct Alberta Health Services to follow the lead of Calgary?
The Honourable Minister.
Well, first of all, Mr. Speaker, that this government happens to believe that if there's voluntary compliance, it's much preferable to the route that the opposition would take, which is having a cop on every corner, Mr. Speaker. So what we have found is that there has been significant voluntary compliance with this initiative, and that, coupled with encouraging the federal government to lead this initiative nationally, I would say is taking a lead role.
The Honourable Leader.
Well, Mr. Speaker, it's very clear this minister has no commitment to prevention or to managing health costs through those processes. How can the minister justify spending less than 2% of the health budget on health protection and disease prevention last year?
Well, Mr. Speaker, I think that that's a good question to ask during our budget estimates that will be coming up in this House shortly. We can debate what is the appropriate dollars and cents, but you know, Mr. Speaker, this is a member who was just talking yesterday about savings. Now he's talking about spending. You know, this particular opposition, Mr. Speaker, can't figure out whether they're conservatives or socialists or whether they're black or white. I'd suggest, in fact, there's a shade of grey over there, and I know that there are some members over there looking for a new name for the party. I'd suggest the Grey Party is a pretty good one. Doom and gloom.